In this video, we'll be talking about how people adjust to living with a chronic disease. If you think about it, adjusting to illness is in many ways no different than adjusting to any difficult situation. And because of that, this topic overlaps a lot with the topics of coping and bereavement. First, how do researchers conceptualize chronic disease? Well, the CDC defines chronic disease as illnesses that are prolonged, do not resolve spontaneously, and are rarely cured completely. However, the psychological definition of chronic disease is a bit more complex, and basically, the meaning of chronic lies in the eyes of the beholder. Determining an exact definition of chronic disease is difficult because it's a complex issue. For example, does a woman stop being a cancer patient when treatment for her breast cancer is completed? What about after being diagnosed as cancer-free for 5 years? The cancer might be gone, but there might be lingering issues after suffering from a chronic illness. As researchers have studied adjustment to chronic disease, they've found 3 broad components regarding adjustment. They are, first, adjustment has a complex nature. Second, adjustment is a dynamic, ongoing process. And third, people adjust to illnesses in unique ways. So, what do these components really mean? The first component to adjusting to an illness is that adjustment has a complex nature. There are many factors to consider when determining how well a person is adjusting to life with a chronic disease. These components have been categorized into 5 main areas. First, mastery of disease-related adaptive tasks. So, for example, a newly diagnosed diabetic would need to learn what foods to eat and what foods to avoid. Second, preservation of functional status. So, for example, one consequence of diabetes is eventual amputation, especially if the diabetic doesn't take care of him or herself. So, preservation of functional status would be remaining healthy to prevent these amputations. Third is perceived quality of life in several domains. So, for example, individuals diagnosed with fibromyalgia suffer from body-wide pain. So their adjustment to illness doesn't just depend on how they view their pain intensity, but also how they perceive other aspects of their lives, such as hanging out with friends or simply doing daily household chores. Fourth is absence of a psychological disorder. So, for example, does a woman with fibromyalgia currently have depression? Fifth is low negative affect. So, for example, is a diabetic person angry that he or she has to watch what he or she eats and monitor his or her blood sugar levels? Researchers have been considering a 6th area that should be added, which is positive indicators of adjustment, such as maintaining positive mood and retaining purpose in life. As you can see, this is different from having low negative affect. A person can be free of lots of negative affect, but they still might not be experiencing a lot of positive emotions. They might just be kind of blah, sort of in a neutral emotional state. The second component of adjustment to illness is that adjustment is a dynamic process. Basically, being diagnosed with a chronic disease doesn't simply change your life at that moment and then nothing changes after that. Chronic diseases can change over time, and your social setting can change how these diseases affect you. So there are 3 main things that affect how you're adjusting to a chronic disease. First is disease severity and prognosis. So, for example, were you recently diagnosed with cardiovascular disease and told you could simply decrease your sodium levels instead of going on some medication to help your heart? Or was it more severe and you were told that you have to go on all kinds of medications, and even then you'll still be at high risk of having a heart attack? The second thing to consider is how fast your health declines. So, for example, if you're diagnosed with cancer and immediately begin chemotherapy, your health's going to decline faster than somebody who goes through surgery to remove a tumor. And third is whether or not the disease involves symptomatic and asymptomatic periods. This is a big issue for many people with chronic diseases. Symptomatic periods are when you can feel the effects of the chronic disease, such as when a fibromyalgia patient is having a pain flare-up. Asymptomatic periods are when you're free of negative health effects of your chronic disease. So sometimes patients with fibromyalgia are pain-free. Fluctuating between symptomatic and asymptomatic periods can be very frustrating for people because at times they feel that they have a handle on their disease, and at other times they feel they've completely lost control. We'll talk about this feeling of control in a little bit. The final component to consider when determining how well people adjust to illness is that people adjust in unique ways to chronic disease. Some people seem to suffer greatly in all respects of their lives due to their chronic disease, while others are able to find meaning and even thrive. Stephen Hawking, who suffers from ALS, is quoted as saying, "Apart from being unlucky enough to get ALS, I have been fortunate in almost every other respect. The help and support I've received have made it possible for me to lead a fairly normal life." So, what is it that helps some people adjust well to living with a chronic disease, and what hurts others? First, we're going to go over some of the factors that contribute to adjustment that are due to people's status or race or gender. And then we're going to go over some other contributors that are more changeable, things that psychologists can target in interventions. So, first, we'll talk about the factors that can't really be changed: socioeconomic status, culture and ethnicity, gender-related issues, and personality attributes. We'll spend a couple of videos on these factors as they relate to overall health later on in the semester, so I'm not going to go into too much detail about them right now. Basically, being in a lower socioeconomic status is related to experiencing more stressful life events and having fewer social and psychological resources to manage these stressors, and this in turn leads to poorer mental and physical health. Additionally, being in a lower socioeconomic bracket means that healthcare is often an economic burden. The new healthcare laws in this country are intended to change that. However, for now, being in a lower socioeconomic status is associated with poorer adjustment to living with a chronic disease. Culture and ethnicity also plays a role in how people adjust to chronic illnesses. Research in this area has basically just found that there are differences between groups in terms of risk factors for diseases, how people then go about getting treatment, and the mental and physical consequences of having a chronic disease. Researchers haven't done much yet to figure out the whys of some of these things, especially the psychological differences in how different groups adjust. There are also gender differences in adjustment. Again, similar to the work on cultures and different ethnic groups, much of the research in this area has focused on what the differences are and not as much on why these differences exist. The main finding is that women with chronic diseases tend to report more depressive symptoms than men diagnosed with the same diseases. In research focusing on cardiovascular disease, researchers have tried to start figuring out why women might be more depressed. They found that after suffering from a heart attack, men tend to reduce their work-related activities and are nurtured and supported by their wives. However, when women return home after suffering from a heart attack, they resume their household responsibilities and chores and receive less support, which might be why they're more distressed than men. The next factor that contributes to adjustment is personality attributes. Researchers have focused on two main things here: personality types that are risk factors for diseases or poor adjustment, and personality types that are protective, leading to better adjustment. As I mentioned, this is an area we're going to cover in more detail later on, so I'm just going to touch on this very briefly. The stereotypical personality type that's considered a risk factor for poor health is type A personality. People who are type A are more hostile and aggressive. They're seen as people who just can't quite relax. Research has shown that people who are type A are more likely to get heart disease. However, none of this work has investigated how being type A might affect adjustment. Dispositional optimism is one personality factor that's been associated with protective health benefits. High optimism is associated with better adjustment for many chronic diseases. For example, among individuals undergoing heart bypass surgery, people with higher optimism had faster in-hospital recovery times and returned to normal life activities faster than individuals with lower optimism. Furthermore, individuals with higher optimism, measured right before a cancer diagnosis, had more positive adjustment over the next year. It's speculated that dispositional optimism seems to be related to increased approach-oriented coping strategies, which might be why this is a protective factor against chronic illnesses. Moving on to the more changeable factors associated with adjustment to chronic illness, the first thing we're going to talk about is social resources and interpersonal support. As you already know, social support can affect how people adjust through physiological, emotional, and cognitive changes. And overall, social support is a good thing. Support tends to lead to positive health benefits. However, sometimes interpersonal relationships can lead to worse adjustment. For example, one group of researchers focused on individuals who had been hospitalized after their first coronary event, such as a heart attack. They found that people who felt that they didn't get the support they wanted had poorer overall adjustment. And interpersonal relationships aren't just between spouses or friends, but they also include relationships between patients and their doctors or other medical staff. Another group of researchers found that cancer patients who felt that their medical team wasn't communicating with them well had increased distress after 3 months. One final example comes from research on women with breast cancer. Women who perceived unsupportive behavior from their spouse had more distress over time. The next factor is cognitive appraisal processes. Remember at the beginning of the semester, we talked about Lazarus and his stress and coping theory. Lazarus said, "What matters is not what event occurs, but how we perceive and interpret the event." This process of perceiving and interpreting an event is called appraisal. Here's the slide from the stress history lecture when we discussed his appraisal process. So part of his appraisal process is determining if the event is positive, negative, or neutral, and if it's negative, then determining whether it's harmful, threatening, or challenging. Basically, after this primary appraisal process, we engage in a secondary appraisal process and determine if our coping abilities and resources are sufficient for overcoming the stressful event. So there are 3 main appraisal processes that have been researched in the adjustment literature. First, perceived threats to life goals. Second, disease-specific expectations, including perceived control. And third, finding meaning. I'm going to go over each of these processes in more detail. First, perceived threats to life goals. Overall, research in this area has shown that people who perceive their illnesses as interfering with treasured goals or intruding on valued activities will most likely experience psychological distress. So, for example, For individuals with chronic pain, those who feel that their illness limits their ability to engage in normal favorite activities, perhaps meeting with friends to play basketball, these people are going to experience more distress. However, individuals with chronic pain who alter their favorite activities, so maybe they just meet up with their friends for lunch, won't experience as much psychological distress. The second process is disease-specific expectations, including perceived control. Having a sense of control has been thoroughly researched in the area of adjustment to chronic disease. People don't like to feel that they don't have control over their lives. It's a very scary and very stressful way to feel. Going through a stressful illness tends to destroy people's feelings of having control over their lives. So one thing that helps with adjustment is believing or perceiving that you have control over things, even if you don't really have control. This is called having an illusion of control or perceived control. I'm going to tell you about 3 studies that suggest that having an illusion of control is healthy, that it leads to healthier outcomes. The first 2 studies were done in nursing homes with a focus on residents' adjustment to their situation. One thing that tends to happen to people when they're first admitted to a nursing home is that they tend to become much more feeble. They tend to get sick fairly soon after entering, and then they die. One of the reasons why people think this might happen is because all of their decisions are taken out of their hands. So in a bunch of studies, researchers tried to increase the residents' feelings of control in several small ways to see if that helped them cope and to see if that helped their physical health at all. In the first study, researchers focused on how to give residents a sense of control and how this affected their health. There were 2 parts to this study. First, the hospital administrator gave a talk to the residents. Residents in the responsibility condition heard a talk that emphasized their responsibility for themselves. Those in the control condition heard a talk that stressed the staff's responsibility for them as patients. Also in this study, all the residents who were participants were given a plant. Those in the responsibility condition were able to take care of their plants by themselves, and those in the control condition didn't take care of their plants. Instead, the nurses did. So what did these researchers find? Well, the people in the responsibility condition became happier, more alert, and more active than the people who were not in charge of taking care of their plants. Also, the nurses rated the residents in the responsibility condition as spending more time visiting with other residents and talking to the staff. The researchers also measured mortality. They found that 18 months later, the residents given control, those who were taking care of their plants, were less likely to have died than the people who were not given control. In fact, they were half as likely to have died, 15% versus 30%. So this study suggests that even having this very small amount of control helped these nursing home residents with adjustment. They were happier, more alert, and had better overall health. In the second study, researchers had a group of student volunteers visit nursing home residents on a regular basis. For residents in the responsibility condition, the residents were in charge of scheduling the visits and telling the students when to come by and visit the nursing home. Residents in the control condition simply had the students show up whenever the researchers scheduled the visits. So the difference between the 2 groups was simply how much control the residents had over scheduling the times of the visits. They didn't differ in how many people actually visited them. So what were the results? The residents in the responsibility condition rated themselves as more hopeful, less lonely, and less bored. Also, the nurses rated these residents as healthier. The residents also had smaller increases in the amounts of medication they needed. So again, we find that residents who were given control over a really quite small matter experienced rather significant health benefits. This sense of control helped with their adjustment to their chronic illness. However, there's a downside to this story. The researchers of this study were interested in how long these health benefits might last, so they did follow-ups at 24, 30, and 42 months after the study ended, so after the visits stopped. They found that residents who had been responsible for scheduling their visits actually had worse health 24 months later than the residents who didn't have any control over their visits. Not only did they have worse health, those in the responsibility condition were more likely to have died than the people in the control condition. So these findings were quite disturbing. Could you imagine if your research had these types of results? What people usually say about this finding is that the subjects were really upset when the study ended because they lost their visitor. They ended up feeling sad and that they no longer had any control in their lives. So the exact thing the study was trying to prevent. This study is often cited as an example of the dangers of doing field studies and an example for why it's important to consider the ethics of your studies. So, could the researchers have known this would happen? Should they have known? Should the researchers have debriefed subjects at the end of the original part of the study? Or should they have told the subjects that their visitors would no longer be coming after the study was over? It's hard to predict these types of outcomes, but clearly it's important for field researchers to be extra careful about the real-world dangers of their studies. The third study focused on coronary patients. Patients in this study were 168 patients who suffered from cardiovascular disease and had undergone surgical procedures to help them with their symptoms, such as a coronary artery bypass graft. In this study, researchers assessed participants' internal locus of control through a survey 3 to 15 months following the hospital procedure. Individuals with high locus of control feel that they have high control over their health. Their health outcomes are influenced by their own actions. People with external locus of control feel that others, or simply the outside world, has control over their health status. So their health outcomes are dependent on luck or fate. These researchers found that patients with high control beliefs, so a higher internal locus of control, return to work sooner than patients with external control beliefs. However, there's a big limitation to this study. Perhaps being able to return to work early led these patients to have higher internal control beliefs. Because of other research suggesting that having internal compared to external control beliefs actually leads to improved health, the researchers who conducted this study didn't think that their results could be explained by reverse causality. They felt pretty confident that it was having internal control beliefs that led to an earlier return to work than the reverse. Now I want to switch gears for a bit and talk about a technique, trauma writing, that helps people cope with chronic illnesses and other stressors. Then we'll talk about how trauma writing might work. Discussing how this technique might work will get us back to cognitive appraisal processes. As it turns out, there's a bunch of evidence that writing about your traumas leads to positive health effects. This evidence comes from a variety of studies conducted with healthy college students and adults, as well as with various sick populations. I'll tell you about 2 of these studies. Most of these writing studies are very similar to each other, so I'm just going to describe the writing method and manipulation in my summary of the first study. In this study, subjects met weekly at the campus health center. The subjects were all healthy undergraduate students. When the subjects showed up for the first day of the study, their blood was drawn so that the researchers could get a baseline measure of their immune functioning. Then the students were randomly assigned to one of two conditions. In one condition, they wrote about a trauma they'd endured, and in the control condition, they wrote about trivial topics. Subjects were asked to write for 20 minutes about their assigned topics, one time a week for about 4 weeks. Subjects who were assigned to the trauma writing condition were given the following instructions. I want you to write about a trauma or personal upheaval that you may be experiencing right now, or that you experienced at some other time in your life. I want you to write about the topic that is personally most significant to you. I want you to just let go and express yourself and write about your deepest thoughts and feelings related to this issue. Ideally, it'll be something that you've not talked about in detail with others. Subjects who were assigned to the trivial topics condition wrote about a different trivial topic each week. For example, one day they simply wrote about their plans for the rest of the day. Subjects came to the health center each week to write about the assigned topics. Afterwards, they filled out a short questionnaire on their moods during the past weeks. They were told that they could keep the essays or hand them in with their questionnaires. 6 weeks after the final writing day, subjects came back to the health center and had their blood drawn so that immune functioning could be measured again. In addition, the researchers counted the number of times that subjects went to the health center because they got sick before, during, or after the study had ended. So what did the researchers find? First of all, the subjects followed the directions of the study and wrote about what they were supposed to write about. They wrote about broken relationships, illnesses of family members, and other traumas. For the number of health center visits, they found that trauma writers showed significantly fewer visits than trivial topic subjects during the month-long writing phase of the study and over the next 3 months. For the blood measures, they found that trauma subjects showed significant improvements over time on 2 different measures of immune functioning, while trivial topic subjects showed no change. These results suggest that writing about past traumatic experiences, in other words, disclosing personal private things, is beneficial to health. There are many other lab studies like this one that use the same format and find similar results. So this is great. It seems like writing about trauma can lead to better health outcomes, so basically better adjustment. But this study was also with healthy people. What about people who are already suffering from a chronic disease? Well, study 2 looked at asthma patients and patients with arthritis. In this study, the researchers did the exact same thing as in the study I just described, but they did it with people who were suffering from asthma or arthritis. These patients came to the lab, wrote about the most stressful event they had ever endured, or an emotionally neutral topic. So this means that the patients in the traumatic writing condition didn't write about how they were coping with asthma or arthritis, but instead they were writing about some other trauma they'd experienced in their lives. The patients did this for 3 consecutive days for 20 minutes each day. So what did they find? The main outcome measure of interest for people with asthma is this measure of pulmonary function called forced expiratory volume in 1 second. It basically measures how well people can breathe. The more air you can breathe out in 1 second, the better off you are. This graph shows what they found on that measure. The black bars are the control group, and the gray bars are the experimental group, so the trauma writing group. At baseline, before the writing sessions, both groups were equal on this. But 4 months later, the subjects who wrote about traumatic topics were breathing much better than the subjects who wrote about neutral topics. So this was a pretty powerful effect. The results for patients with arthritis were similar. Again, on this graph, the black bars are the control group, and the gray bars are the experimental group. The arthritis patients in the trauma writing condition showed significant reductions in disease activity 4 months later compared to baseline. So how might trauma writing lead to better health? We've suggested quite strongly that writing about your problems is a healthy thing to do. These findings are very exciting, but we don't fully understand them. Researchers are trying to figure out how doing this type of writing can help you stay healthy. They've had various hypotheses over the years, and I'm going to take you through a sort of chronological history of these hypotheses, and then show you what we currently think might be going on. The original hypothesis about how this worked is that inhibiting something about yourself is a very severe stressor. And as you know, stressors are bad for your health. By writing about these traumas, you're disclosing them, so you're no longer inhibiting them. So the stressor goes away, which is good for your health. So, is there any evidence that inhibiting information about yourself is bad for you? Steve Cole has looked at the effects of inhibition on health. He compared people who were inhibiting something very significant about themselves to people who were not inhibiting something about themselves. Cole looked at a sample of HIV-infected gay males who had been studied and followed by researchers already for 8 years. He divided them up into those who were closeted and those who were out of the closet. This is kind of hard to do because sometimes people are out to some people but not others, but he carefully divided them up, and then he measured HIV progression using a standard measure of immune function, which was, at the time, the best measure available. The measure he used was helper T cell count, a measure of the CD4 lymphocytes in the bloodstream. These T cells are crucial for fighting off infections, so it's a very good measure of immune function. You want to have a lot of these cells working for you. He controlled statistically for every background factor that he could think of that might influence immune function or HIV progression, or that might be related to being closeted. Things like age, smoking, drug or alcohol use, exercise, or whether or not his participants were taking their HIV meds. He found that being closeted led to more rapid CD4 decline. On this graph, the x-axis is the number of years since the participant joined the study, and the y-axis is showing you their CD4 levels. Higher CD4 levels are better. You can see from the graph that those participants who were closeted, which is the lower solid line, these participants' T cell count decreased faster than the T cell counts for participants who were out of the closet, which is the dotted line up there on top. He also looked at AIDS progression and mortality. He found that being closeted led to a more rapid onset of AIDS and an earlier death. He found that participants who were out of the closet, so people who weren't inhibiting this personal information, took nearly 2 years longer to get full-blown AIDS and lived nearly 2 years longer. These effects were similar in size to the effects of being on AZT, the best drug available to treat HIV at the time of the study. So that means that being out of the closet was as good for your health as being on AIDS medication. So that's what this graph is showing you. Although I know it looks a little bit complicated, participants who are still in the closet are the solid line, and participants who are out of the closet are the dotted lines. The first line to drop off is the solid line, showing that participants in the closet developed AIDS sooner. The second line shows you that closeted participants died sooner. The dotted lines show you that participants who were openly gay developed AIDS later and then died later. So, according to this study, inhibiting something central about your identity was found to be bad for your health. But the unhealthiness of inhibiting personal information can't be the whole story, because in some studies, They asked people to disclose traumas they had already disclosed to other people, and it still helped them. And in other studies, they had people write about a trauma that didn't happen to them, and even that helped. So disclosing can be part of the story, but not the whole story. So what else might explain why writing about traumas helps people? Well, some other research suggests that the thing about writing that might be beneficial is that writing helps people find meaning. And this brings us to the final factor that's part of the cognitive appraisal processes that contribute to adjustment to chronic disease and to our second hypothesis about how these writing exercises might be good for you. Hypothesis 2 is that finding meaning or benefit finding is beneficial to our health. Soon we'll pick up on our story about trauma writing, but first let me explain what I mean by finding meaning or finding benefits in traumatic events. At first, it seems ridiculous that people should say anything good came from their serious illness, but people really do find meaning in their traumas. I've already mentioned the quote from Stephen Hawking. He's at least found a positive side to his life, even though he suffers from ALS. Helen Keller may be one of the most famous examples of someone who found meaning with her disabilities. Helen Keller was born both deaf and blind. However, through the help of her teacher, Anne Sullivan, she was finally able to learn how to really communicate with others. She even learned her Bachelor's of Arts degree. Through her disabilities, she found her true calling of being a political activist. She was a world-famous speaker and author, as well as an advocate for people with disabilities. Now, you might just think that this is just one extreme example. However, it's not that unusual to find good things in serious illness. One study of men who had just had their first heart attack found that over half of these men reported benefits from the heart attack, like changes in values or philosophies of life. So it's pretty amazing to find that people are able to experience benefits or find meaning from their traumas, because traumas tend to shake people up. In particular, experiencing a trauma changes the way that we see the world, so our assumptions about the world. Psychologists and philosophers have argued that people have some pretty basic assumptions that provide us with expectations about ourselves and the world. Normally, we're not aware that we're making these assumptions, but when something goes wrong and these assumptions are violated, they become exposed. The first assumption is that the world is meaningful. This assumption implies that events happen for a reason. When bad things happen, it's very difficult to come up with a reason for our misfortunes. This is a good example of this world is meaningful idea. The reason that this one car got hit by a tree is because it's almost as if Mother Nature was playing Duck, Duck, Goose. Or I am aware that here in Minnesota, it's Duck, Duck, Gray Duck. Anyways, it's really difficult for people to come up with reasons for why bad things happen. After September 11th, people spent a lot of time asking why. They were trying to find meaning in what had happened. A lot of articles had comments suggesting that it was unacceptable to think that it was just random dumb luck that distinguished between who lived and who died that day. If you went toward one stairway, you lived. If you went toward another, you died. If your office was on one floor, you lived. If it was on another, you died. If you left the second building when the first building collapsed, you didn't die. But if you stayed in the second building, you did. These all seemed so random. But having whether you lived or died left up to random chance just didn't seem acceptable. So many of the popular press articles written at the time were about how people survived and how they felt after they were being spared. And many of these people were looking for reasons. A group of researchers conducted a longitudinal study to assess the effects of searching for meaning and finding meaning after the 9/11 attacks. These researchers surveyed nearly 1,000 people 2 months post 9/11 as well as 2 years after 9/11. They found that people who were still searching for meaning after 9/11, 2 years after the event, had higher levels of post-traumatic stress. But people who had already found meaning in the event had lower stress symptoms, even after controlling for pre-9/11 health, exposure to 9/11, and acute stress response. So these results suggest that successfully finding meaning is beneficial to your health. The second main assumption is that the world is just. This means that people get what they deserve and deserve what they get. If a good thing happens to a good person, we tend to assume that it happened to the person because the person deserved it. And we say this all the time. It couldn't have happened to a more deserving person. But if something bad happens to somebody, people also frequently assume that somehow that person deserved it. In the case of bad things happening, this isn't always a very pretty assumption to hold, particularly if you're the person who has something bad happen to you. It's this view of the world as being just that motivates people to instantly ask if the guy diagnosed with lung cancer was a smoker. If you believe that you're generally a good person and cautious, and then you suffer some kind of trauma, you'll have a serious problem grappling with this assumption of the world being just. The world won't appear meaningful or just to you at all anymore. Your assumptions will basically just be shattered. So people who are coping with an illness often have this need to make sense out of it. Now think back to the writing studies. They originally thought it was something about disclosing information about yourself that led to these beneficial health effects. But more recent work suggests that it wasn't the disclosure that was helping these people, but rather that when people wrote about these situations, they tended to make sense out of them. In other words, they found meaning. And that led to a new hypothesis about those trauma writing studies and why they're beneficial to your health. So this new hypothesis about the writing studies is that the positive health effects are due to cognitive changes associated with writing. So it's not merely disclosing things per se that matters, but expression in writing. According to this hypothesis, the critical aspect of expression is making sense of what happened to you and finding insight or finding meaning. If this is the case, then people who try to make sense of their trauma and fail shouldn't be helped by writing. Bauer and colleagues conducted a study to determine whether this was true. Specifically, Bauer was interested in determining whether the important thing about these writing manipulations was trying to find meaning or actually succeeding in finding meaning. She wanted to see if everyone who tried to answer the why me question stayed healthy, or only those people who successfully answered it. She interviewed 40 HIV-infected males soon after the death of a close friend or partner to AIDS. She interviewed them for a long time about all their thoughts and feelings about the loss. The interviews were transcribed, and then people coded them for signs of attempts to find meaning, which she defined as deliberate, purposeful attempts to make sense of the event, trying to accept the reality of the death, and thinking about one's own life in light of the death. Nearly 2/3 of the men showed these attempts to find meaning. The interviews were also coded for signs of the person succeeding in discovering meaning in the experience. This was defined as a major shift in values, priorities, or perspective in response to the loss. Things like a greater appreciation for loved ones, an enhanced sense of living in the present, a perception of life as fragile and precious, a commitment to enjoying life, and an enhanced sense of spirituality or faith. They then followed these men and measured the progression of their illness over time. They found that over a 2 to 3 year follow-up period, those men whose interviews were coded as having tried and succeeded to find meaning didn't show a decrease in T cells over the 3 years. But men who either didn't try to find meaning or who had tried to find meaning but failed showed substantial decreases in T cell count, which is a strong indicator of disease progression. And that's what this graph is showing you. The x-axis is time, and the y-axis is the number of CD4 cells. The black dots are the men who found meaning, and you can see that their CD4 cells didn't decrease over the follow-up period. In addition, finding meaning was significantly related to mortality. Of the 40 men in the study, 15 died of AIDS. Only 3 of those 15 reported finding meaning, whereas over half of the 25 survivors reported finding meaning in the loss. So this study shows that finding meaning is associated with good health outcomes. In addition, it suggests that it's not just merely efforts to find meaning that's helpful, but specifically the kind of effort that results in finding meaning. If people just ruminate about the problem endlessly, never really getting anywhere, they're not going to have very good health outcomes. This is similar to the Stanton study, which suggested that emotional processing doesn't really improve your health benefits, but emotional expression does. Okay, so finding meaning in difficult experiences helps people to cope with them and may even improve people's health. But this research isn't perfect. This is a small study, and they didn't really manipulate finding meaning. In fact, if you think about it, that's going to be pretty hard to do. So it's not clear whether finding meaning actually helped them stay healthy, or if some other thing that helped them to find meaning also helped them to stay healthy. So here's another example of a group of researchers who tested the finding meaning hypothesis. This group of researchers wondered if finding meaning just made people start to take better care of themselves, which could explain why finding meaning makes people healthier. So most people think of this as a pretty boring explanation of these findings, but it seems plausible. So when these researchers looked through a lot of studies on finding meaning, they noticed that most studies didn't ask participants about health behaviors. So it wasn't really possible to tell if finding meaning was leading them to take better care of themselves. And on top of that, a lot of the studies defined finding meaning as to include taking better care of your health. So if someone's writing mentioned that they were now taking vitamins and exercising, these studies are calling that finding meaning. So in other words, some studies actually confounded taking better care of one's health with finding meaning. So the researchers studied a sample of HIV-infected women and gave each woman a journal in which they wrote at least twice a week for 4 weeks. Before the researchers gave them the journals, they asked the subjects to fill out a bunch of questionnaires, which included questions about the most important health behavior for staying healthy with HIV, specifically adhering to your medications. If you take your medications when you're supposed to and the way that you're supposed to, you can keep your viral load really low. But if you don't take your medications regularly, you can create a virus that's resistant to all known medications. So it's very important for HIV patients to adhere to their medications. At the end of the study, the women filled out the same questionnaires, and the researchers were able to see their adherence at both the beginning and the end of the study. They took the subjects' journal entries and coded each entry for signs of finding meaning. And of course, they didn't count mentions of healthy behaviors as finding meaning, so that they wouldn't have to worry about confounding finding meaning and engaging in healthy behaviors. Here are some examples of statements that were coded as showing signs of finding meaning. Knowing what I know now about being sick makes me see life in a whole different way. It made me realize how I appreciate life more now than I have in the past, and I live one day at a time and try to enjoy each day to the fullest. I love life and have learned to value it dearly. So what did the researchers find? Well, they found that participants who showed signs of finding meaning in their writing increased their medication adherence from time 1 to time 2. But participants who didn't discover meaning decreased their medication adherence from time 1 to time 2. So finding meaning was associated with taking better care of one's health. Thus, if finding meaning does ultimately make people healthier, engaging in healthier behaviors could be how this happens. But this is just one study, and we don't know for sure if engaging in healthier behaviors is how finding meaning always works to improve people's health. The third hypothesis that's been tested to get at what makes writing improve your health is that writing helps people to affirm their positive values, which has been linked to good health outcomes. We've talked about affirming your positive values before, when we talked about health communications, and I showed you some studies in which affirming one's positive values helped people to be less defensive when they were given threatening health information. Just to refresh your memory, we call this self-affirmation. I have defined it slightly different here as a positive reflection on a valued source of self-worth. Remember, these sources of self-worth could be any number of things, and they can be different for different people. David Creswell is an expert on the health benefits of affirming the self. He conducted a study in which he looked for signs of self-affirmation in the writing of cancer patients. He thought it was possible that writing could lead to better health outcomes because when you write, you affirm the self. In his study, he had breast cancer patients write 4 essays over a 3-week period, and then he coded those essays for signs of self-affirmation. He also coded these essays for signs of finding meaning, and then he measured the subject's physical symptoms in cancer-related doctor visits 3 months later. He found that participants who affirmed the self had fewer physical symptoms 3 months later and fewer cancer-related doctor visits 3 months later, compared to participants who didn't affirm the self. In addition, he compared participants who found meaning to those who didn't, and he didn't find any differences between these two groups in their physical symptoms or doctor visits. So from this study, it seems that perhaps the active ingredient in these writing studies is self-affirmation rather than finding meaning. More work needs to be done here, but you can see that this is a pretty exciting and evolving area of study. I also want to show you one more thing about self-affirmation from David Creswell's work. He did a study in which he exposed subjects in his lab to the Trier social stress task, which you'll remember from previous videos that this task has been shown to lead to a strong stress response among subjects. In Creswell's study, before doing the stressful task, he had half of his subjects affirm their self-worth by answering questions about something they highly valued. He asked subjects to rank order a list of 5 values, which included politics, religion, and social issues. Then, for the subjects who affirmed their self-worth, these subjects answered questions about the value they ranked most highly. The control subjects, on the other hand, answered questions about their lowest ranked value. In this study, he measured cortisol response, which you'll remember that cortisol is a hormone of the HPA axis that leads to many of those health problems we talked about when we talked about stress. And here's what he found. First, to orient you to the graph, along the x-axis is time. So the first part, the first time point there is baseline before doing the stress task, then 20 minutes after the task, 30 minutes, and 45 minutes after it. The darker line with the black dots is the value affirmation group, and the lighter line with the white dots is the control group. The subjects in the control group are showing a normal cortisol response to stress. It jumps up within 20 minutes of the stress, it stays up for a while, and then it starts to come down, but it doesn't make it all the way down to baseline. But now look at the participants who affirmed their most positive value. Their stress hardly goes up at all, they stay very near baseline the whole time, and by the 45-minute point, they're actually a bit lower than their baseline. So, affirming the self, as corny as it may sound, can be quite beneficial to your health.